Yo, everybody, what's up? It is your friendly neighborhood physical therapist, Dr. Whelton, coming to you from just outside the beautiful Tampa Bay area. If you are new to following me, I have a clinic where most of my patients have what I call the I've failed everything story. They try this, they try that, they try this, nobody knows what's wrong with them type thing from what they tell me, right? And I've learned to get exceptional results in that patient population. I teach this. I've been teaching this for the better part of a decade. I have published statistically historic papers in not just the field of orthopedics, but medicine itself in readership that I pinned to my social media channel. And when I uploaded those analytics from the journal itself to, from the journal to AI, it says these are landmark foundational historic papers in the field of orthopedics. And getting multiple times what even it says with the New England Journal of Medicine or the Lancet, get 3 to 5 years post-publication. So anyways, those are on my website, wheltonmethods.com. I also linked here to join my free school group, my VIP group, okay, where I'm sharing more clinical insights and more cash-based clinic insights. So click that link right now and it'll take you over to the school group. Join that. And if you want to take your game to the next level, because that is what my goal is in teaching, is to get us diagnostically and treatment-wise up here, okay? Also, let's see here. So today I am talking about, what am I talking about? I am talking about low back pain, okay? So there's a tip-off with low back pain, okay? And the tip, over the years, I've sat in here and I've listened to people, and the more you do this thing, the more you generally know what's wrong with the person just by taking their history, but in my case, with these I've failed everything type clinic, I call it, that like I look at, like, if someone's tried physical therapy, chiropractic, injection surgery, orthopedic surgeon, neurosurgeon, x-ray, MRI, massage, acupuncture, repeat, that's what I call the I've failed everything story. When I see that, I'm thinking something that doesn't show up on an x-ray and MRI, like SI joint dysfunction generally doesn't show up. Sacral torsion shear doesn't show up. And these are debilitating conditions. I wrote that in my sacral paper that 57% of these people have contemplated that. They told me, I wrote it up, and I published it in a medical journal. Now, the tip-off, taking someone's history, ask these questions, okay? So for years, I've been treating this patient population, specifically low back pain that, generally the patients are just frustrated. They threw their hands up in the air and they just said, nobody knows what's wrong with me. I'm tired of going to doctors, right? But over the years, they had the same complaints. They were like, they say, I can't sleep on my side. Why? Because your SI joint, if you look at the jagged edges there, okay, your SI joint is like shearing itself when you sleep on your side. That's out of alignment. That's why they can't sleep, okay? So they can't sleep on their side. They can't sit on certain surfaces, okay? When you're either with SI joint, which can refer into the back, right? Even SI joint dysfunction, where if you do it bilaterally, then the whole back is lit up, okay? Even SI joint dysfunction, but sacral torsions and shears cause that too. So when your sacrum torsions, then it causes a shearing pain at the base of your spine, which is why it hurts to sit, okay? When I sit for a long period of time and then try to get up, or when I get up in the morning, it's hell. And the reason why they say that is because what I tell them is, like, you ever stretch your hamstrings and, like, during the day, and you can, like, I don't know, reach your ankles, right? But then when you get up in the morning, after 8 hours of sleep, and then you're in the shower and you try to, like, you can barely touch your knees, right? Well, the reason why is because you weren't using it, so it contracted, right? But the same thing happens in all the muscles, right? That you're not moving, right? So it just locks down. So that's why when these people sit in long car rides, when people try to get up in the morning, that's why it's like it's agony for them, because it just locked down even further out of alignment. Okay, so it hurts to lay on your side, sit on certain surfaces, similar to an arthritis patient where it hurts to be immobile for a while, sitting, whatever, stationary, and then get up and get moving again to loosen it up, right? And they also have trouble bending, extending back. And this is excruciating. The reason why I keep talking about this is because I have this, what I failed everything clinic. And this is what I see all day. A lot of these people are totally debilitated, either on disability or they lose their jobs. They can't stand up anymore. They can't even sleep at night. And a lot of them don't want to deal with it anymore. And nobody knows what's wrong because it's a mechanical issue. You have to see it move and understand what's happening. Okay. So if you just ask these questions to a your evals. Does it hurt to sit on certain surfaces? Does it hurt to roll over in bed is another one. Does it hurt to lay on your side, extend back, bend forward? Does it hurt to stand after sitting for a while, or sleeping, like getting up in the morning? Then those are the main complaints of these people that I've found. And they'll say, yeah, so it's something that we have to be screening for, because we are supposed to be the biomechanical experts, like physical therapists, chiropractors, athletic trainers, OTs, whatever. We're supposed to be the biomechanical experts, but most of my patients have tried physical therapy, and they either get told there's nothing wrong with you or they get laughed at. One lady got literally laughed at by a physical therapist because she said she had groin pain. Groin pain is literally not, this isn't my chart. This is documented SI joint referred pain patterns, right? Stop laughing at people, It's just because you can't figure it out doesn't mean that there's nothing wrong with the person, It's crazy. So literally. So anyways, let's just real quick, I propose in my SI paper and in my courses, join my VIP group where I'm talking about this much more, and I'm starting to teach this live, as well as the cash-based clinic, is that the person I propose that SI joint dysfunction is caused by an upslip and or out flare of the pelvis, out, okay? And so if you go to my YouTube channel, Whelton Methods, okay? There's so many of these videos that I'm posting in the VIP group where I pull on the person's leg, make sure they don't have hip replacements or surgeries, okay? You pull on the person's leg, lay on your side, and gap it open like that, okay? And when you do that, realign the upslip and or out flare, but they usually both on one side, and then the other side, usually I find is just an out flare in my patients. Then you do that, and a lot of their pain goes away, okay? If not all of it. But the sacral torsion patients, which I find that it's very rare, I see SI joint without sacral torsion or shear. And what happens is that, it's interesting, it always rotates to the same side. So you can test this by doing a 90-90 piriformis strength test. And when you do a 90-90 piriformis strength test, you'll see the right side is typically weaker significantly, which causes an imbalance with the piriformis, and then it starts to rotate that way, where you would have to strengthen the right piriformis to bring it back. Just test them in a 90-90. Okay, that's another tip off. Okay, because I rarely see sacral torsions alone. It's usually SI and sacral torsion shear. Okay, so if you just do a 90-90 piriformis test on a low back patient and the right side significantly weaker, then it's tipping you off that there's something going on mechanically that causes a torsion and a shear. A lot of the times I find in my patients. Okay, so we have to be acutely aware of what is happening with these patients, because when they slip through the cracks, man, you should hear the stories I hear and hear. It's bonkers what I hear and hear. what these poor people have gone through. Most of them have spent $20,000 to $120,000 by the time they get here. To try everything, it's tragic, but I'm out here screaming about it because I'm trying to save. We have Save the Whales. We have, this awareness month, that awareness month. There should be a whole month to save the to save the mechanical back pain patients. I should put a sticker on my car instead of Save the Whales to save the mechanical back pain patients, because it's crazy. I teach people how to open and run cash-based clinics now, very successful ones, $400 for 30 minutes, based off results, not sales techniques, results. And they get the patient out of pain immediately and demonstrate that you know what you're doing, which I teach how I do it. And then the patient trusts that you know what you're doing. We don't have to sell to them, right? And but I have people that are doing this business model, and their whole clinic is full of SI patients, SI sacral patients. And if you read the reviews, it's the same stories. It's the same, I've failed this, I've failed that, nobody knows what's wrong with me. But if you read the reviews, it says there are mechanical issues going on in there. And this guy or girl, figured it out. So if you want to not just change lives, save lives, then I got a job for you. I will teach you how to a totally different cash-based business model. A lot of people are stuck at 10,000, 15, 20,000. It's totally different. You get paid for your ability. You get paid for your investment in your education. Everybody's got a DPT or a DC, but you get paid actually in this business model to be excellent at your job, okay, the way it should be. No medical communism. We all get paid $50 or $20 from the scam insurance companies type thing, okay? All right, so everybody ask those questions and join my group. It's right there, school group, linked right there. Join it, it's free. I'm teaching more about chronic pain conditions, how to diagnose, how I treat, and here with my patients. And then I also have a clinical mentorship where I teach live, and you get 59% off all my courses. And then I have a hybrid business clinical mentorship where I teach how to help, not just help the clinical part of what I do, and here are the chronic pain patients, but I also am teaching how to open and run one of my cash-based business, totally different than most people, based on results, not on sales techniques. Okay. Anyways, gotta go. Peace. Love you all.